Good morning, everyone, and welcome to our 2024 World COPD Day event. My name is Meraki Shawandai. My peers and I will be presenting today's webinar. We're all students at San José University's Department of Public Health and Recreation, and I'd like to introduce you to my team now. Starting off, we have Sheila Masavasu, Catherine Achechery, and Kayla Medellin. We're here today to talk to you about COPD, or chronic obstructive pulmonary disease, a condition affecting millions of people with more being diagnosed every day. We're also here to talk about the impact of COPD in our communities and to bring hope to those living with this condition. This project is a collaboration with Breathe California of the Bay Area, Golden Gate, and Central Coast. It's been a pleasure working with Breathe California staff, and we're very happy that you're attending our event today. And here's our agenda. We'll begin with words from a Breathe California staff member. Then Dr. MIHAELA Stefan will deliver today's keynote address. We'll continue with a fun online bingo game, then some great information from physical therapist SHILPA DATT. After that, you'll have a chance to win some door prizes, and finally, Yoga Instructor ASHWINI SURPUR will take us through some beneficial breathing exercises. Now, I'd love to introduce Sharmin Sultana.
Thank you so much, Maraki. Hello, everyone. This is Sharmin Sultana. I'm the Senior Health Program Director at Breathe California, which is one of the state's oldest voluntary health organizations. We are founded in San Jose in 1911. That means that we have been addressing critical lung health threats, promoting healthy lifestyles, and reducing the impact of lung disease through prevention, education, patient support, research, and advocacy for 113 years. From 1911 on, we spent several decades fighting the tuberculosis epidemic with great success. Over the years, our partnership-focused approach and our skill at adapting has allowed us to face new lung health challenges as they arise. Our work has expanded into the areas of asthma, tobacco prevention and sedation, lung cancer, environmental stewardship, clean air, and providing CPAP machines at low cost to sleep apnea patients. Our most recent activities have been related to the vaping epidemic, COVID-19, RSV, and protecting lung health during wildfire seasons. Now, first, I would like to thank the Learn More, Breathe Better program of the National Heart, Lung, and Blood Institute. It is a key partner in our common efforts to educate people about COPD. As a federal agency, they must follow guidelines around how they are represented, so you will not see their logo on our promotional materials. We still want to acknowledge their support, not only for this event, but for that which they give to groups and individuals across the country. They run the Breathe Better program, which you can join, translate research into the usable information for the public and for the healthcare professionals, and provide a wide array of educational materials, all of which you will find on their website at www.nhlbi.nih.gov/breathebetter. We'd also like to thank Santa Clara Family Health Plan and Fomet Medical Research for partnering with us to support this event. Now, I would like to introduce Breathe California's Chief Executive Officer, Dr. Tania Payapalli.
Thank you, Sharmin. I am so pleased Breathe California can continue to honor World COPD Day each year. Thanks to Santa Clara Family Health Plan for working with us to make this event special every year. And currently, we are collaborating with Fomet Medical Research to invite COPD patients 40 to 80 years old to participate in a clinical trial. I encourage all of you present here to explore the advancements in COPD treatment research. And if you or your patients are interested in learning more about this trial, please feel free to contact me or Sharmin. You'll have our contact information at the end of this presentation. And finally, I would like to thank our wonderful students here who have been working so hard for the last few months to plan and present today's webinar. And Breathe California sees great value in collaborating with young community leaders like yourself to foster your professional development as health educators. So we are very happy to be working with these talented students from San Jose State's public health program. And they're responsible for this event's success today. And of course, I want to thank my team, Brian and Charmine, for coordinating the tech setup and everything and training our budding public health leaders. Thank you all for being here. And on that note, I will hand you off to Catherine.
Thank you, Tanya. I would like to thank everyone attending today's event. We hope that you will learn a lot and have some fun doing it. On our agenda today are 2 guest speakers, a COPD bingo game, and some great yoga breathing exercises that will be beneficial for everyone. I'd like to welcome our keynote speaker, Dr. MIHAELA STEFAN. We are truly fortunate to have her here with us today. Dr. MIHAELA STEFAN is a program officer with the Division of Lung Disease at the National Heart, Lung, and Blood Institute of the National Institutes of Health. Before joining the organization in 2022, she was a clinician, investigator, and associate professor of medicine at the University of Massachusetts Medical School Bay State, and the associate director of implementation science at UMMS Bay State's Institute for Healthcare Delivery and Population Science. Dr. Stefan obtained a PhD in clinical and translational science from Tufts University and worked at an academic hospitalis at Bay State Health in Western Massachusetts. Her research interests include implementation science, palliative care, improving representation in clinical trials, constructive obstructive pulmonary disease, and critical care. Please give Dr. Stefan your attention during presentation. If you have questions for her, please click the Q&A button on your screen. After she finished, we will continue with the question and answer session. And now on today's keynote speech, take it away, Dr. Stefan.
All right. Thank you very much for inviting me to present at this meeting. Today is, of course, the COPD World International Day, and the entire month is dedicated to awareness to COPD. So this is, I will try to make it even more important for you and understand why this month is important and why awareness of COPD is key. Let's see. Okay. So I'll start with some quick facts. COPD stands for chronic obstructive pulmonary disease, and it remains a leading cause of death, accounting for more than 140,000 deaths per year. The prevalence is high and not improving. It's 6% of all US adults being diagnosed with COPD, meaning that 6 out of 100 people have COPD. Approximately 17 million people have been diagnosed with COPD, but many more don't know they have it. So we are treating only the tip of the iceberg. It is a leading cause of disability, meaning that is a progressive disease that worsens over time and makes it difficult to carry the daily activities. So what is COPD? It's a serious long-term lung condition that makes it hard to breathe. In simple terms, imagine your lungs as a pair of balloons that helps you take in oxygen and get rid of carbon dioxide. With COPD, these balloons don't work as well as they should. And when you have COPD, the tiny sacs where the oxygen exchange occurs can become damaged, and the walls between many air sacs are destroyed. Also, the airway in your lungs become inflamed and narrowed and makes more mucus than usual. And this makes it difficult for air to flow in and out. Left untreated, people with COPD gradually lose their stamina and ability to perform daily activities. COPD includes 2 main conditions. One is chronic bronchitis, which involves inflammation of the lining of the bronchial tubes, which carry air to and from the air sacs, which we call in medical terms alveoli. And this inflammation leads to swelling and the production of mucus, which can obstruct airway and make breathing difficult. A persistent cough that produces mucus or sputum is a common symptom. The other condition is called emphysema, which involves damage to the alveoli, the tiny air sacs in the lungs where oxygen exchange occurs. And over time, the walls of the alveoli are destroyed, leading to larger air spaces instead of many small ones. This reduces the surface available for oxygen exchange, make it harder for the lungs to transfer the oxygen into the bloodstream. What are the common symptoms of COPD? Chronic cough, often referred as smoker's cough, and this persistent cough may produce mucus sputum that can be clear, white, yellow, or greenish. And in a way, that's a problem that we call it smoker cough, because people think that it's just because of smoking and is not related to a real condition. Shortness of breath, which is especially noticeable during physical activities or exertion. Wheezing, a whistling or squeaky sound when breathing, particularly during exhalation. Chest tightness or inability to breathe easily or take a deep breath, or a feeling of constriction or heaviness in the chest area. And also frequent respiratory infection, with people with COPD being more prone to colds, flu, and pneumonia. So what is the main cause or risk factors for COPD? As you probably all know, is smoking, which is responsible for roughly 8 out of 10 COPD death. Smoking is the number one cause of COPD, and 75%, so 3/4 of the COPD cases occur in people who have a history of smoking. And you see that is kind of equally distributed between current smoker and former smokers. However, roughly 1 out of 4 people who have COPD had never smoked. So there are additional causes and risk factors. And one of them is air pollution, and long-term exposure to outdoor air pollution, particularly in urban areas, is one of the risk factors. Indoor air pollution, prolonged exposure to indoor air pollutants such as smoke from burning fuel for cooking or heating in poorly ventilated homes, and exposure to second-hand smoke can contribute to the development of COPD in non-smoker. Occupational exposure, people who work in environments with dust, with chemical fumes or vapors, such as in factories, mining, or construction, may be at increased risk. And then there is a genetic condition, a rare genetic disorder, which is called alpha-1 antitrypsin deficiency, can lead to COPD, even in individuals who have never smoked. Alpha-1 antitrypsin is a protein produced by the liver that helps protect the lungs from inflammation caused by infections and inhaled irritants. In individuals with alpha-1 antitrypsin deficiency, there is a lack or dysfunction of the protein. So the protein doesn't work well, and the lungs are more susceptible to damage, leading to development of emphysema at a younger age than typically seen in smoker. But I want to emphasize that while these factors can increase the risk of developing COPD, not everyone with these risk factors will necessarily develop the disease. Who is at higher risk of COPD? Although COPD affects all Americans, some are more at risk than others. And you see here that contrary to the general belief, women are at a higher risk than men. The difference is small, but still 7% of women and 6% of men have been diagnosed with COPD. In regards to the geographic distribution, the prevalence, it's more in the rural areas, almost twice that in the urban areas. There is a higher prevalence in the southeast and areas of the Mississippi and Ohio River Valley. And if you ever have a chance to see the maps of smoking, of how high is the smoking in an area and the prevalence of COPD, you'll see that they overlap. So people who are in the southeast and in the Mississippi and Ohio, they are more likely to smoke, and that's the main reason there is more COPD there. And racial and ethnic groups, more than 1 in 10 American Indians and Alaska Natives have been diagnosed with COPD, which is such a higher proportion than in any other racial and ethnic groups in the US. How do we diagnose COPD? It involves a combination between medical history, physical exam, and specific tests. And here are the key steps typically involved in diagnosis COPD. Medical history and symptoms. So the healthcare provider will ask about symptoms such as chronic cough, shortness of breath, and wheezing. They will also inquire about smoking history, exposure to lung irritants, family history of lung disease, and past respiratory infection. Then is a physical exam, and during the physical examination, the provider will listen to your lungs for abnormal sounds, such as wheezing or crackling, which can indicate lung problems. Spirometry, I'll talk a little later about this, but is the primary test used to diagnose COPD. Imaging test, a chest X-ray or a computer tomography scan, which can provide images of the lungs and help identify emphysema, other lung disease, or heart problem that might be causing symptoms similar to COPD. An arterial blood gas measures the level of oxygen and carbon dioxide in your blood. And then additional test, if an alpha-1 antitrypsin is suspected, the genetic disease I spoke earlier about, a blood test to measure level of this protein might be conducted. And it is an easy test, so it's not such a complicated test to diagnose this condition. So it is estimated that millions of individuals with COPD do not realize that they have COPD and are undiagnosed. And some of the reason you see on the right, the top diagnosis barriers healthcare providers encounter, is that patients not always report their symptoms or smoking history to their providers, but it's also on the other side that providers sometimes don't do a good deep into the symptoms. And patients go to the primary care and they have more urgent issues, and then they go with those and they don't report the new symptoms that might be significant for COPD. So I was telling you that the main test that diagnoses COPD is called spirometry. And this is a quick and simple breathing test that checks how well your lungs are working. And this is not a sophisticated test. It's not that you need to go in different places. Many primary care physicians have the availability to do spirometry in their office. And the test shows how healthy the lungs are if you have COPD and how serious it is, and can help your provider diagnose this condition even before you have symptoms. So for someone who has history of smoking, a test might be required if they also have some family history or their conditions had changed. So now how can someone with COPD live well or live better with this condition? Because this can be challenging, but there are several strategies and lifestyle changes that can help individuals manage their symptoms and improve their quality of life. The first and the most important is quit smoking. So if you smoke, quitting is the most important step you can take. Smoking cessation can slow the progression of COPD and improve lung function. And for this, you should not do it alone, or if your loved one is smoking, you should help them get support from healthcare provider, from smoking cessation programs and medication. We have right now various medication for helping with smoking cessation. Avoid lung irritants, so minimize exposure to air pollution, dust, chemical fumes, and other environmental irritants. Use air purifiers and ensure good ventilation at home. Stay up to date with the vaccination, and I'll talk about this in a next slide. follow a treatment plan, work closely with your healthcare provider to develop a comprehensive treatment plan, and visit your provider regularly and take your prescribed medications. Exercise regularly and eat a healthy diet. Practice breathing techniques, and I understood that this would be in the next presentation, and get support from family and friends, and even join support groups. Connect with others with COPD through support group online communities to share experiences, tips, and encouragement. What about COPD and vaccines? We know that patients with COPD are at higher risk of serious complications from certain illnesses preventable with vaccination. Vaccination are an important part of managing the condition, the COPD, and preventing complications. And the following vaccines are generally recommended: annual flu shot, RSV, pneumococcal, and COVID-19 vaccines, including the recommended booster. So there is this misconception that if you get vaccinated, you will not get that disease, which is not true. Even if you got vaccinated, you might still get that condition. However, the severity of the condition will be much less. So the chance for bad outcomes and complication if you get vaccinated, it's much less. So this is why it's also important, because sometimes people say like, oh, I got vaccinated, but I got the flu also. But that's not the point. So please go and have the vaccines, because these are so important to prevent exacerbations. So now, of those who have COPD or know someone who does, about half are interested in getting more information about COPD treatment, and also about what is done in regards to research for new treatment and new interventions for COPD. And I will present a little bit some studies that we are doing right now and might be of interest. Now, a little bit about the treatment of COPD. We know that as now, there is no cure for COPD, but the disease is treatable and manageable. And here are the common approaches to managing COPD. I'll start in a different order than is on the slide, with the lifestyle changes, which I think are so important, and sometimes people are missing it and just jump to the medication. Even the primary care might go with the medications, but not emphasize the lifestyle changes. As we discussed, smoking cessation is so important. And then we'll talk a little bit more in other slides about pulmonary rehabilitation. In regards to the medications, there are several classes. One is, and the most common use is bronchodilators, which dilate the airway, and they are the first line of treatment. They are short-acting, so immediate when there is shortness of breath, or long-acting that people take them, let's say, in the morning and act for the entire day, and they help relax the muscles around the airways. Then there are inhaled corticosteroids. They reduce the inflammation in the airway. These two medications, the bronchodilators and corticosteroids, can be combined in inhalers, so they have both of these medications and they are easier to administer. There are some other type of anti-inflammatory medication, a little newer. And then there are mucolytics that help thin and loosen mucus in the airway. Oxygen therapy for those with severe COPD and low levels of oxygen in their blood, supplemental oxygen may be prescribed. Vaccination, we already talked about this. And there are some surgical options: endobronchial valves, lung volume reduction surgery, where surgery will be used to remove diseased lung tissues and can improve breathing. Bulectomy, which is a removal of a large airspace that can form in the lung. And in very severe cases where other treatments have failed, lung transplant. Another method to help live better is called palliative care. palliative care is also known as supportive care, and it is key in managing COPD. The care is focused on helping the patient achieve the best possible quality of life, and it is appropriate for all people living with COPD, regardless of stage or prognosis. Now to pulmonary rehabilitation, which is a critical intervention in managing COPD. Pulmonary rehabilitation may help people with chronic breathing problem to live and breathe better. And 2 out of 3 people who participate in pulmonary rehab report positive outcome. Pulmonary rehab can help reducing symptoms, increasing physical activity, improving daily function, and emotional health. Pulmonary rehab is typically conducting in an outpatient setting, often involve a multidisciplinary team of healthcare professionals, including doctors, nurses, physical therapists, and dietitian. And it is important for patients to continue with the exercises and lifestyle changes learned during PR to maintain the benefits over the long term. The possible benefits from the program, in addition to the improving strengths and active lifestyle, is increasing the understanding and management of the disease, reducing symptoms of depression and anxiety, and peer support. So pulmonary rehab is not just the exercises. There are multiple layers of support around the exercise. So the program includes, in addition to exercising, breathing technique, instruction in finding easier, energy-saving ways to do everyday tasks, helps with smoking cessation. There is psychological counseling for emotional problems, and nutritional counseling for optimal health. We know that current limitations to pulmonary rehab include poor access to the facilities and capacity constraints at those facilities. So the researchers started to develop video telehealth, which might improve access, especially for patients who live in low population area or for whom transportation is difficult. And one study, a smaller one that was supported by our institute, suggested that video telehealth confers similar benefits to center-based rehab. And now we have several other trials, other studies that are exploring ways of delivering pulmonary rehab through various forms of telehealth. We discussed earlier that COPD is more frequent in the rural individuals, and I want to present one of the studies where we try to understand regional differences in rates of disease like COPD. This is done in rural Appalachia and Mississippi Delta. And this team comprised researchers for 16 different institutions, is looking at 10 counties and 4 states, evaluating the health of more than 4,000 participants over 6 years. So we hope to understand why it's more frequent in the rural area and how we can help patients have better outcomes there. Now, another study is, and I talk a little bit about air pollution and the air purifiers. So we have 2 studies that just started to understand the effectiveness of indoor air cleaners for improving the life of people with COPD. The first one is called the Clean Air Study, and it's a large study in multiple sites in the United States. It's a 6-year, which is testing if an air cleaner intervention to remove indoor air pollutants will improve quality of life and decrease risk among former smokers with COPD. And then another study is about air cleaner and wildfire smoke study. It's also a study that will test if an intervention with multiple steps, including an air cleaner, will decrease the exposure to air pollution from wildfire in patients with COPD with low socioeconomic status. So awareness of COPD. This is the COPD Awareness Month, and today is the COPD International World Day. So the awareness of COPD has increased in the past 10 years, yet nearly 1/4 of adults in the US have not heard about COPD. Roughly 3 out of 10 people with COPD symptoms go undiagnosed and untreated. And awareness can vary significantly among individuals, and many people are not initially aware that they have this condition. And there are several factors which contribute to this lack of awareness. One is gradual onset of symptoms, with people attributing these symptoms to aging, smoking, or lack of fitness, rather than recognizing them as a sign of a chronic lung condition. And individuals may not seek attention until symptoms become severe, or healthcare provider may not initially suspect COPD, especially in younger patients or non-smoker. The second reason is lack of knowledge, what I just described here, that there is a general lack of public awareness about COPD compared to other chronic conditions. People may not be familiar with the disease or its symptoms, leading to a delay in seeking diagnosis and treatment. And then there is stigma. There is stigma associated with COPD, particularly because of its strong association with smoking, and people may be reluctant to discuss their symptoms or seek medical help due to fear to judgment. So this is why we need this type of public health campaigns and education initiatives, and I'm very grateful and appreciative that your organization is doing such a public campaign to inform people about risk factors and symptoms and encourage individuals, especially those of risks, to undergo testing and talk with their primary care physician. Now, I want to talk a little bit of something that our institute, at the request of the Congress, input from the broad COPD community built, is called the COPD National Action Plan. And this is the first ever blueprint for a multifaceted, unified fight against COPD. It provides a comprehensive framework for actions by those affected by the disease and those who care about reducing its burden. And you can access it at copd.nih.gov. COPD National Action Plan has 5 main goals. One is around empowering people with COPD, their families and caregivers to recognize and reduce the burden of COPD. The second is to improve the prevention, diagnosis, treatment, and management of COPD by improving the quality of care delivered across the healthcare continuum. The third is to collect, analyze, report, and disseminate COPD-related public health data that drive change and track progress. The fourth is to increase and sustain research to better understand prevention, pathogenesis, diagnosis, treatment, and management of COPD. And the fifth is to translate national policy, educational, and program recommendation into research and public healthcare action. So this COPD action plan was developed in 2018, and just last week we had a workshop where we convened the community of COPD organizations that are interested, and they're part of the initial COPD action plan, with the goal of re-engaging them and also see what and if this COPD action plan needs to be updated. The workshop was a success. We had a lot of participation and interactions, showing that the advocacy organization and communities are very interested in the fight against this disease. So there is also a community tool, part of the COPD National Action Plan, which is a central repository for COPD community to capture activities, see and report on progress, so we can see what is done in the community. And for example, what you did today will be included in this community action tool report. There are many organizations that are featured in the community action tool, and you see here, Breeze, California, The program that was mentioned at the beginning, the Learn More, Breathe Better, is developed by NHLBI and provide free resources about symptoms, diagnosis, treatment, and management for patients and caregivers. And it has a lot of resources, and I encourage you to explore it. It has animated video, fact sheets, infographic, and social media. And the resources are not only for the patients and their caregivers, but also for healthcare providers, provider toolkit, teaching tool, patient handout, so you can go back to your primary care and share with them if they didn't know about. We have also something called the COPD Caregiver Toolkit, which contains modules and videos about COPD management, questions for the doctor, self-care tips, and more. We know that there is a big burden for the caregivers of those with COPD. It has infographic and social media graphic. It has checklist and forms, and it's a really very friendly type of toolkit that will help you support your loved one with COPD. And these are some additional resources. The Learn More, Breathe Better website is at COPD, NHLBI, NIH.gov. The National Action Plan that I mentioned, copd.nih.gov. And the NHLBI Respiratory Health Association, COPD Caregivers Toolkit, nhlbi.nih.gov/COPD caregivers. And these are the references if anyone is interested. And that's what I have. And I'll stop sharing.
Thank you so much, Dr. Stefan, for your great presentation. I think we all learned a lot. We appreciate your knowledge and experience and are honored that you're sharing with our audience today. We do have some questions for you that have populated in the chat. First, why did you pick this career path?
Okay, so that's interesting. So before I joining NHLBI, I was a hospitalist and I was a researcher with focus on COPD. So my research was in the COPD field, and I was also a clinician. I treated patients with COPD, and this was the focus of my clinical work. But I decided to become a program officer. This is my function at the National Heart, Lung, and Blood Institute for several reasons. So as a program officer, I could help guide and support research project instead of working on a specific area, kind of a narrow, small one. I got to see the bigger picture of various projects and research studies and how they fit together to solve big health problems. Also in my work, I could decide which research studies should get funded, which means I could have a big impact on the direction of medical research. So you have to imagine that we have funding, right? And investigator, researcher apply for this funding. There is a way to grade those studies, not by us, but by others in the field. But then with those scores, they come to us. So our job is to think, where is the gap? So even if this specific study maybe did not get the higher score, but we know that we don't have research in that area at all. So this is how we can somehow influence what is to be funded. So I use my knowledge of experience to make sure that best idea and projects are supported to find new treatments and cure for heart, lung, blood diseases. And again, my role helped me, instead of focusing on one area, just to influence many projects.
Oh, thank you. Your knowledge is very greatly appreciated. The next question is, how do you begin with your research question? What are some inspirations that come up for you and your team?
Okay, with the research question, that's interesting. And because I think having a research question and how you do it should start, we should teach people from early great to think about a research question because it's like being a detective looking for clues to solve a mystery. And when a researcher wants to improve the care of disease like COPD, they begin by asking questions that can lead to better understanding treatment. And to come up with a good research question, you need to know the field. You need to learn everything about that specific area. So I will read scientific articles, I talk with doctors and patients, and look at what studies have already been done. So this helps me to see what mysteries still needs to be solved. And inspiration for research question can come from many places. Sometimes a researcher might notice a pattern, like patients with COPD who exercise seems to feel better. This might lead to a question like, how does exercise affect breathing in people with COPD? And this was kind of the base of building the pulmonary rehab and having all these studies that demonstrated in the end that indeed exercise is better for patients with COPD. I think also talking with patients, at least for me, was a great source of inspiration because patients may share challenges they face, such as difficulty using inhalers. So this would inspire a question like, what new tools, what new devices can help patients use their inhaler more easily? Researchers also get ideas from new technologies or scientific discoveries. So there is a new medication discovered and they may think, oh, can we repurpose, can you use this medication for COPD, although it was developed for a different disease? And once a research question is formed, so we come up with a research question, we design the study and the experiments, we gather data, we analyze results, and we share the findings with others. And these findings might get us to the next research questions.
Wonderful. And then you also mentioned getting vaccinated. Why are vaccines so important for people with COPD?
Yeah, I saw a little bit, and I can't emphasize more about vaccines, how important they are. So there are some important reasons. So one, individuals with COPD are at higher risk for respiratory infection, such as influenza and pneumonia, and this can exacerbate their condition and lead to severe health complications. Vaccination can help prevent respiratory infection that might trigger COPD exacerbations, and any exacerbation leads to a decrease in the lung function and overall health. And vaccination can decrease the likelihood of hospitalization due to respiratory infection. And the vaccine can protect against severe outcomes from infection, including prolonged illness, complication, and even death. So, for example, flu vaccine has been shown to reduce the severity of the disease in those who get vaccinated but still get sick. But I think it's important for each patient to go and talk with their healthcare provider to discuss their specific vaccination needs and what is their profile, so what they would be appropriate for them. And keep in mind that vaccination are one of the safest way to protect your health. Side effects are usually mild and they go away on their own. So I can't encourage more the vaccination. People reach out to medications, but lifestyle, vaccination, pulmonary rehab may be more important than only reaching first to the vaccination. So not saying that medication are not important, but not only the medication, but you need to put all this around the medications.
Yeah, I completely agree with what you said in vaccines, how they're so important. Can you share some of the latest ideas in treatment and how they might be available to others?
Sure, I will try. So studies might change how we understand COPD, and now being inside of the lung division, I have a better vision of how much work and how many studies we are supported to help cure COPD. And we don't have a cure right now, but that's our goal. That's what we hope. We hope to improve management, but also having a cure. So I will mention some of the latest advancement. There is a category of drugs which are called biologic therapies, and this treatment focuses on specific parts of the body's immune response. And scientists are studying how this could help people with COPD. And in fact, there is a new medication that just a few months ago was tested in 2 consecutive studies, one of these biological products that show that in people with COPD who have a special profile in their blood cell count, they are really helped by this medication. And it's a medication that was used in asthma, and now it proved that in a population of patients with COPD, it can help. So this is what I was talking a little earlier about our research question, right? So we have this medication, we know that it works very well in asthma. Can we try it in COPD and see if it works? And it proved that it works, was even approved by the FDA just a few weeks ago. Another category that was developed is triple combination inhalers. So I've told you about bronchodilators and anti-inflammatory medications. And this is not like a new medication, but it's a device that makes it more easy for patients to be compliant. Because just think, if you have this disease and you have like 3 different inhalers that you have to use it like 2-3 times a day, it's kind of hard to keep track of them and use them correctly. So this is a progress. Then there is something that we call precision medicine. And this means creating treatments that are just right for each patient based on their genes and maybe lifestyle and maybe their environment. Research in genetics could lead to more personalized care. And you probably heard about so much research in genetics. And we are trying to figure out what is the genetic profile that first patients are more likely to develop COPD, but who is less likely to develop. So what can be protective, but also use this for treatments. And then even more futuristic is regenerative medicine, how using stem cells to heal lung tissue damaged by COPD. This is in early phases, but it looks promising. So this is when we're talking about the cure, right? And then when I said surgical treatment, I mentioned something called endobronchial valves. This is also kind of a new therapy. And there are tiny devices that are placed in the lung to block damaged area in patients with emphysema, where I told you that the air sacs are damaged, and helps healthier parts of the lung work better and make it easier to breathe. So the timeline for availability of these treatments can vary. Some are in use, as I mentioned, and others are still in research and development stages. But I can reassure you that NHLBI is very committed toward improving the life of patients with COPD, and the funding for COPD new treatments is strong, and it's supported by the leadership.
Perfect. Thank you so much. I think that was very helpful. Somebody asked, if I don't have a pulmonary rehabilitation center near me, is there a way I could do the exercises at home?
It is. I've told you that we are testing in some studies video telerehab, and it is very promising. But here, what I would recommend some steps to get you started. So first of all, consult your healthcare provider, because they can assess you what is the level of or physical therapy provider. I'm not talking only about your primary care but also a physical therapist who can evaluate what level of effort is appropriate for you. The care provider can offer guidance tailored to your specific needs and limitation. You can consider virtual programs because especially during COVID, you know that we kind of moved towards this video and remote and telehealth. And some healthcare provider and organization already offer virtually pulmonary rehab programs, which can provide guidance and support. There are also online resources, but what I would advise is to use videos and guidelines from reputable health organization, not just go online and try something. And when you think of performing something at home, you think of having a safe environment and monitoring your symptoms. If you have oxygen requirement, it's very important that during exercises, you will check your oxygen saturation with the monitor.
Okay, perfect. Somebody said, I heard that palliative care could be helpful for people with advanced COPD, but I thought it was only for people who were dying. Do you have more on that?
Yeah, thank you. So in my prior life, when I was a hospitalist, I was also a palliative care doctor. So it's very dear to my heart. And there is this misconception that palliative care is hospice, which is absolutely not correct. Palliative care is a great support for people with COPD because it focuses on improving life quality and it helps in several ways. And I can't encourage you more than talking with your primary care if you have advanced COPD about requesting a consult with the palliative care team because they can help manage symptoms like breathlessness, coughing, and fatigue by suggesting not only medications, but also lifestyle changes. And they have this time. The team includes doctors, nurses, social workers, and therapists who work together to provide personalized care and is a Medicare benefit. So it's not that you are paying out of pocket for this. This team helps patients and their families with advanced care planning. And I think this is very, very important. It's not like, oh, I'm thinking of, I'm not optimistic, I'm pessimistic and thinking. I mean, in a way or another, we all get there to the end. So having an advanced care planning, which involves making decisions about future health cares, including end life choices, is very important. And they also offer emotional and mental support, not only to the patients, but also to the caregivers overall. They reduce the burden of symptoms and improve quality of life.
Okay, awesome. And it looks like that was all of the questions for today. So thank you so much for answering those for us.
Of course.
And
Thank you for inviting me. And this is I mean, the more we can do of this, the better will be to get awareness. Thank you.
thank you so much. And now Catherine will introduce our next speaker.
Thank you so much, Kayla. Now I'd like to introduce Shilpa Datt. Shilpa is a physical therapist with over 2 decades of professional healthcare experience as a physical therapist and certified case manager working in acute hospital settings, skilled nursing facilities, home health, and hospice. Shilpa has worked with COPD patients and patients with other respiratory conditions, including those on ventilator support or with tracheostomies. As a therapist, she has provided patients and caregivers with training and education on energy conservation techniques, the use of assistive devices, and safety. She's enthusiastic about a wide range of modalities to promote healing and overall wellness, believing in a deep connection between mind, body, and soul. Take it away, Shilpa.
Thank you, Catherine, for that wonderful introduction. And thank you, everyone, for joining us today. We appreciate your time. And without any further delay, let me go ahead and share some slides. All right, so COPD, it's all about how you conserve your energy. Energy conservation means adapting the way you carry out your day-to-day activities, things that you have to do and things that you would like to do. So how do we go about energy conservation? And what is the importance of energy conservation techniques? So energy conservation techniques can improve your overall quality of life and helps you get through your day efficiently and productively. I like to, believe in this 7 P's. First one being prioritizing what needs to be done, keeping your schedule simple. Try to spread your activities, your household chores throughout the week rather than just having to do everything on a weekend or Sunday or Monday. Planning is as important as prioritizing. You start your day, which is with the most strenuous activities. Make sure you avoid overworking. You can alternate heavy and light tasks, and if possible, skip some activities. Pacing is, again, number 3, but equally important. Don't rush. Realize before you feel that you're getting tired. So you need to rest before you get tired. Try and keeping the schedule flexible that would allow taking breaks or skipping activities. Positioning. The body mechanics plays very, very important role on how it affects your breathing. Keeping your body straight helps you breathe longer and fresher air rather than stooping your shoulder or bending down, keeping your spine bent. It compresses your lung and will not let you breathe to the fullest. Positive attitude. We always say, I know it's easier said than done, but positive attitude is equally very, very important. Focus on things that you can do. Be creative in finding ways to adapt to your activities. For example, you can, maybe sit down instead of standing up to do some activities. Use assistive devices like reacher or a shoe guard. The 6th one is the breathing. And I know that you're going to have another speaker, telling you about importance of breathing. So I'll keep it very small. This one, we call it pursed lip breathing. Basically, you are exhaling through your mouth and taking it as twice as long as you inhale. And practicing relaxation. Again, that is, practicing relaxation. It helps restore your energy to the body. Any techniques such as meditation or, focusing on your breathing would help with relaxation. These are very important tips of activities of daily living. Again, this goes very well with planning or positioning. Make sure you have a dressing area. You dress your lower half of the body first, which usually tends to take more energy. If you can sit down to dress, undress, wash and dry using a bath stool or a stool where you can keep it in the bathroom. Maybe choosing a loose fitting and lightweight clothes that helps it make it easier on your body. Make sure your bathrooms are ventilated. Avoid using aerosols rather use roll-ons or deodorant cream instead. You can try and use electric gadget, like shavers and other gadgets that helps expedite hygiene activities. Cooking, you can cook, if you can cook large quantities and then try to store individual sized portions. So you can freeze it so that you can have the meals and you don't have to prepare them every day. You may choose to use the ready meals, or I know that there are quite a few resources often in the community where the meals get delivered. If your resources would allow, there are also other meal services that would deliver at home. Household works. Again, like we talked about, making sure that you spread the cleaning task over the week. Small things like putting maybe garbage by the door so you don't have to go back and forth emptying it frequently. keeping dishes soaked so that you can conserve some energy and eliminate scrubbing. Asking a family or friends to help you with the heavier jobs, maybe like gardening or mowing the lawn, or even heavy grocery lifting. Again, lightweight bedding and pillows. Making a list of things you need, using electric cart, trying to organize so that you don't have to bend too far and you can reach on the shelf. Keeping perishable and non-perishable food separately so it's easier and accessible. Again, asking for help, do lighter shopping yourself, maybe have the bulky shopping delivered, or ask for help for friends, family, neighbors. In this era of internet shopping, there may be a lot more options available. Another tip for laundry, using a reacher, sitting down to ironing, using a rolling cart for transporting clothes. Some other tips for gardening, making sure everything is on reach. You can use the wheel stand and so forth and so on. Again, ask for help, reach out to people. There is nothing in asking for help. People love to help, and it make your life easier, and they would appreciate you asking them. Thank you, and thank you again for all your time, and I'm available to answer any questions you may have. If we don't have time, Brian can share my email, and I'll be more than happy to answer any questions you may have.
Thank you, Shilpa. We have really shared a lot of useful and easy ways that people with COPD can improve their quality of life.
And now back to Catherine.
Thank you so much, Kayla. And now for our final special guest, ASHWINI SURPUR. ASHWINI is the Executive Director of Yoga Bharati and a senior yoga therapist. She has worked at Oracle as a software engineer for 15 years and transitioned into a new position in 2010, joining Yoga Bharati as a full-time volunteer staff member. She provides yoga therapy to clients with various disorders and specializes in cancer and terminally ill patients. She is passionate about literature and philosophy and has a master's in an MA in Sanskrit. She writes poems in her free time. ASHWINI will now lead us in some yoga breathing exercises that are suitable for all and adaptable as needed. Please proceed, ASHWINI.
Thank you. Hello, everyone. Welcome to the World COPD Day, where we would like to begin our journey with breathing. We begin our journey of life with breathing. So let us go back, become that little life that we came in as. And the first thing we did was we took a deep breath, we cried. That crying is basically not anything but actually breathing. So today we'll go back to the breathing basics, and we will look at how to breathe in such a way that one is, as a baby, how do we breathe? We breathe, we have a belly breathing, right? Because as babies, we take breath from the depth of the belly, from the depth of the lungs. So let us look into different breathing techniques. So sit comfortably, back straight. Take a few deep breaths. Take a breath all the way down. Awareness on the abdomen. As you inhale, the abdomen bulges out. And as you exhale, relax. There is no hurry to inhale after every exhalation. Take a breath when you need one. And take a deep breath. And then exhale slowly. No hurry to inhale or exhale. No extra holding of the breath anywhere. Just follow the body's need. All you're doing is bringing awareness to the breath. The breath is supposed to be long and subtle. In Sanskrit, it says Dirgha Sukshmaha. Patanjali, the ancient master who taught breathing and yoga, says it has to be long and subtle. So when we say long, we don't forcefully inhale. We just allow the lungs to expand. And gently stop the practice. That itself grounds you enough, and that itself is a breathing practice on its own. Just all it is bringing awareness. Now we'll bring some special practices to enhance this same experience, and how to build your lungs, lung capacity, or the muscles of the lungs, the muscles around the lungs, that is the intercostal muscles, how to bring strength to all of this. So sometimes we also can voluntarily breathe and manipulate the breath in such a way that you're building the lung capacity. So how to do that? So let us take, there is a breathing technique called Ujjayi breathing. We'll do three things. One is the Ujjayi breathing, which is actually an effortful breathing in a way, but that is to build the lung capacity. And the cousin of that is the making the sound, B breath. So we'll do B breath after that. And the third one will be very simple, awareness of the breath at the lower lobes of the lungs, at the middle lobes of the lungs, and the upper lobes of the lungs. So 3-part breathing. So we'll do all these three. So now let us talk about Ujjayi breathing. Ujjayi means to be able to breathe in a way, making a little hissing sound at the throat level. You're constricting the glottis, you're taking a deep breath, and you are exhaling with that sound at the throat level, only audible to you. It's not a huge sound. So it may be a little too much for some people. If it is too slow, that will also not be a good idea. So you just let it out, not being too ambitious about that, about being slow. Yes, we do want the breath to be big and slow and long, but no effort involved. There should not be too much effort, just a slight pushing against the boundary. Okay, so how long you are going to exhale. So inhale deeply, constrict the glottis, making a little sound at the throat level as long as the breath lasts. Okay, and then again take a deep breath, and again sound. Inhale deeply and exhale slowly, sound, an S sound at the throat level. Continue. When all of the breath goes out, take a deep breath again. And again, exhale. A few more times, inhale deeply. Make a nice hissing sound. And exhale. Inhale fully. And exhale, making the sound, S sound. Last one, inhale fully. Exhale as slow, as long as it possibly can. and relax. Close your eyes and practice the same breath awarefulness practice that we did in the beginning, just observing the breath. Nothing to do here, just being aware of the breath, the sound, if anything, any sound that it generates, the cooling effect as you inhale, the warming effect as you exhale. Observe the nose and nostrils. As you inhale, you feel cool air entering into the nostrils. And as you exhale, feel the warmth, temperature awareness. And gently moving on with the next one, which is going to be the B sound. So we are going to inhale, and holding the breath, we just let out the air by chanting sound. We'll do that practice. So before we continue with that practice, I'm just going to give a science behind that. So there's something called nitric oxide, which is generated when you practice, nose breathing, especially the nasal resistance. Mouth breathing is not considered great. Why? Because when you breathe through the nose, there is an airway resistance, and that resistance generates nitric oxide, which is excellent for immunity and for cardiovascular health. So when you practice Ujjayi, the one that we did just now, that is, you are creating an artificial nasal resistance and resistance at the throat level also, and letting the breath out slowly, more nitric oxide is created in the body. And now with the B breath, where you're chanting the B buzzing sound, the nitric oxide is, how much nitric oxide is generated? 15 times, not just 15% more, 15 times more nitric oxide is generated with a low pitch humming sound, which is what we are going to do now. Okay, so basically what you're going to be doing is inhaling and creating this sound, okay, as long as you can. Again, don't overdo anything, but at the same time, don't underdo anything. We just want to push against that boundary, okay? So let's do that long hissing sound, long B sound, okay? Let's begin. Inhale. Can hear the whole sound. I was chanting until now. Yes, okay. Now, can you chant until now? May not be. It can be longer than my chant, or it can be shorter than my chant. We are going to do this for about a good 5 minutes. So in that case, what do? You follow your own breathing pattern. It doesn't have to be as long as me. It can be longer. It can be shorter. So your breathing, your lungs, it's yours. And then take a break between them. If you feel tired, you want to stop. And when you're ready, take another breath and again start chanting. Okay, we'll do that a few times. And always comfort is the one that tells you whether you're doing it more or less. If you feel panting, tired, and if the lungs are tired, you're overdoing it. So listen to that. Okay, let's begin. Sit comfortably, back straight, eyes closed, and inhale and begin. Last 3. Stopping the practice, eyes closed. Observe your breath, your mind. If you felt relaxed, if you felt refreshed, you did well. If you felt tired, you may want to cut down, keep taking breaks. And now we'll do one more similar practice when I feel maybe not so good in my lungs. Okay, some days the breath probably is not great. Then how do I practice the same one, the same B breath? How do I do that? So very simple. There you are not actually practicing and pushing against the envelope, but you are letting the air out with a little sound. It seems a little distressing to hear this, but it's actually very good practice for you. So for others, it may sound like, oh my God, are you okay? But you are actually practicing it pretty, you're letting the air out with a very low pitch humming. This is what they were talking about when they say low pitch humming. This is research is done on this. So the way it goes is like this. So inhale, not too much, okay? Here, because you assume that some days maybe, weather is bad, there's a little distress in the breathing, allergies, asthma, whatever it could be, right? Or maybe virus, okay? So the way to do this, You see, I'm letting the air out with a little bit of a resistance. That's why that sound. You start with and let the rest of the air go out on its own. So you're not really overextending that buzzing bee sound, but you're letting the air out at the end. So you create an initial resistance. You can also hold your breath just a bit like that. Letting it out. So go ahead, let's do this. A smaller, much smaller, maybe 1/3 of your earlier length. Okay, let's do that a few times. Just allowing the air to go out with a little sound. 10 times. Inhale. practice after a few times, maybe max 10, and then observe the difference, the changes. You should feel more relaxed at the lungs, at the mind. A small, low pitch humming sound, which lasts only 1/3 of the breath, and the rest of the breath goes out in silence. And even a little sound at the end, like a sighing sound, perfectly okay and excellent in creating nitric oxide, fighting those viruses, those infections, if any. And coming to the last part, we'll just do 3-part breathing. Simply take your hand to the belly and just breathe, allowing the breath to go to the belly. Although the breath doesn't go into the belly, your lower lobes of the lungs will get expanded and you feel a belly rising. Inhale and exhale. No huge breathing, just the shape of the lungs changes. Inhale and exhale. Relax. Inhale and exhale and relax. At your own pace. No hurry to inhale. Take a breath when you need one and observe the abdomen rising like a balloon expanding with every breath. And gently bring your hand down onto your thighs. Observe the breath. And now moving on to chest level breathing, bring your hand on the chest and allow the breath to go onto the chest region. So you'll feel that the shape of the lungs now changes differently. So inhale, expand the chest. Exhale and relax. Focus on the chest, expanding. The abdomen stays where it is and the chest expands as you inhale and relaxes as you exhale. And now bring your hand down and observe your breath. And now take your hands on the shoulders and allow the breath to stretch your shoulders upwards. You are not lifting the shoulders, it's the breath that is lifting the shoulders. Inhale, the breath, the chest and the shoulders expand upwards, and exhale and relax. All it is just the shape of the lungs change. And you feel the breath in various parts of the lungs. Inhale and exhale and relax. You are anchoring at that relaxed state of the lungs. You take a breath when you need one. And gently bring your hands down, eyes closed, observe. The last part will be all 3 parts. So you can also take your one hand on the abdomen, one hand on the chest. As you inhale, the abdomen expands, the chest expands, and the shoulders move upwards. And as you exhale, let go. Inhale, expand your abdomen, chest, and shoulders. Exhale, the lungs recoil on their own, nothing to do. No worry about which part goes down or anything. Just allow the lungs to relax each time. Inhale, the abdomen, chest, and the shoulders expand. And exhale and relax. And gently bring your hands down. So each time you want to relax, because if you went on breathing without relaxation, you will be hyperventilating, which is not good. So you want to breathe when there is a need for the breath, and then you let go. So deep breathing, at the same time, a little gap between every breath. And again, the gap is never more than your need. You don't extend that gap. You just allow that gap. So now close your eyes and we'll practice what we did before, which is just observing the breath. And you will find that the last breathing that we did, which is called full yogic breathing, happens on its own as you go on practicing breath awareness. Yogic breathing becomes your second nature. Although initially you'll be doing it with awareness, as you practice, deep breathing becomes your nature, and you don't need to spend your energy observing also. It is your own natural rhythm. And as the breath deepens and slows down, your mind deepens and slows down. Depth of thinking, yet there is no stress. Depth of breathing, yet there is no hyperventilation or stress. And the alveoli start building up as you go on breathing well and deep. Better gas exchange, better oxygenation of the cells. And gently open your eyes. Thank you. Namaste.
Thank you so much, Ashwini. After practicing the techniques that you have shown us today, I hope that our audience members feel as centered and relaxed as I feel. Now, as we near the end of today's event, I'll pass you to Meraki.
Thank you, Catherine. Before we finish up, we would like to know about how much you learned today in our presentation. In a moment, a little window will pop up asking you, did you learn something during our presentation? Please choose your answer, either A for a lot or B for a little. Just like you, I learned a lot today. And thank you for your answers. And thank you so much for coming to our event today. We are incredibly, incredibly grateful to today's expert speakers and our sponsors and partners and Breathe California staff for making this event so successful. We hope that you'll be able to put what you learned today to good use. Thanks again to our partners, Santa Clara Family Health Plan and FOMAT Medical Research. Please be aware that you will find tons of useful information and materials about COPD in many languages on the website of our partners at the NHLBI at www.nhlbi.nih.gov/breathebetter. And thank you. If you have any questions about lung health programs that Breathe California offers in the Bay Area communities, please visit www.lungsareus.org to learn more. We appreciated your time and presentation. Have a wonderful day and take care.